you, Wanda and Carol, for your input on the flipped classroom. My name is Lakeisha Dixon, and I hope you have enjoyed our presentation thus far. I'm going to talk to you about how to use the flipped classroom in your future classroom. So where do you begin? You begin with recording your lectures. You can do this by using a PowerPoint with a voiceover, audio, or you can do a video lecture. These lectures are uploaded into whatever your institution is using as their platform. Of course, at Winston-Salem State University, we are using Blackboard. So you would upload your videos into the Blackboard platform. These videos should be uploaded at least a week in advance or a week prior to the class so that students are able to review the information, listen to the audio, and be prepared when they come to class. You want to have some type of learning activity ready for students when they come to class so that there is no lecture involved. That is the purpose of the flipped classroom, is so that you're not standing in front of the class just lecturing or reviewing PowerPoints. So what can you do to incorporate or to make all of this come together? So, for example, you could create a case scenario related to a topic such as cardiac and have a patient suffering from an MI or congestive heart failure. To facilitate this activity, you can have students to work in groups and have them discuss different scenarios. At the end of class, students can present their findings to the class. This promotes dialogue amongst the students, and it also promotes peer learning, or facilitates peer learning, because students are able to talk to each other in their groups and are able to discuss what they've learned or what they've read or reviewed in the week prior to coming to class. And this is just one way that you can do that. Also, you can use case studies in your classroom and use multiple choice questions to ask questions related to the case study. In the practicum where I am, my preceptor favors the case study because she feels it promotes critical thinking, it promotes dialogue in the classroom, and it keeps her students awake. But also they use the clickers so that they are able to choose their answers, and she can kind of evaluate how many students are participating. Usually she waits for everybody to answer the question before moving on or before discussing the question. So case studies with the use of multiple choice questions and the clickers are also a good way to provide an active learning activity in your classroom. So how do you use the flipped classroom in the clinical setting? So in this case, we decided that we would use as an example students going to clinical on a neuroscience unit. Prior to going to clinical, students received a video that was posted into their Blackboard platform. The students received a video on the NIH stroke scale so that they can review prior to coming to clinical. Once at clinical, during the pre and the post-clinical, students will be given a CBA case study. And after clinical is done, the students and the preceptor can discuss this case study. But the main objective for using the case study is to see if students have learned or have understood how to use the NIH stroke scale to indicate the patient's score. So appropriately score the patient. So this is a good way to incorporate the flipped classroom into the clinical setting. So our next couple of slides really just give you some information on how to use the flipped classroom in your classroom. Again, it gives you tips, things you can do. There are videos that show you how other people have incorporated the flipped classroom concept into their classrooms. I hope that you have enjoyed our presentation and that you will be able to use this concept in your future classroom. Again, thank you.